Every year, 1 in 5 Australian workers will experience a mental health condition.
Half of those say they'd feel uncomfortable discussing mental health with their managers.
And the hidden cost of poor mental health in Australian workplaces has been valued at over $1 billion annually.
For over 30 years, Pathways has been providing services to people who have experienced the negative impacts of mental illness. Recently, we've been focused on providing support to services and businesses and organisations to help employers maintain a mentally well workplace. First is a 1 to 2 hour free session where we can come and talk to you about mental health in the workplace. The second is a half day to full day session where we can go into more detail and help you develop a plan for your organisation. And the third, really importantly, is a course called Mental Health First Aid, which we can deliver over 2 days to up to 16 to 18 of your staff to give them a really solid grounding and foundation in mental health.
The Pathways Mental Health First Aid training was life-changing for me. It really was. It changed my perspective on mental health. It really broke down the stigma of what mental health is. Prior to doing this course, I don't know what I'd do with a mental health illness. But now I believe that I've got the tools to cope with the situation and to be able to action those.
I've seen the program change lives and I've seen it save lives. The major part of the course is to look at some of the more common mental health conditions and look at some of the signs and symptoms, what to look for, what might someone be saying or doing that might be indicating that things are not travelling well for them. So who should be doing mental health first aid in a workplace? Ideally everyone. However, at a bare minimum, team leaders, managers, people who are at that decision-making level, who set the tone for an organisation, they should be doing it.
The first aid training provided a real framework for the staff members. Mental health is such a silent illness that it's something that's very hard to detect. By running the program, it's given our staff members a lot of confidence to be able to tackle these issues as they come up, and also it helps to spread a really positive wellbeing message at the club.
Sometimes we do come across interesting characters in this line of work, and I've found since completing the mental health first aid training at Pathways, my fear has gone and I now have the courage to maybe approach these people and strike up a conversation rather than just avoid them and maybe hope that they would move on.
There's key financial benefits to having a mentally healthy workplace. We know a lot about absenteeism, it's a measure. We sometimes don't recognise the costs of presenteeism. And presenteeism refers to when people are in the workplace but they're just not functioning well. And that is particularly common with white-collar workers, with managers. They're more likely to be in the workplace and not functioning well rather than taking sick days. And that's a huge cost to an organisation.
Mental health in the workplace is everyone's business, and as employers we have a role to play, and in fact a great opportunity to promote good mental health.
Because everyone deserves a chance to be spectacular.
Be spectacular.
Be spectacular.